Thank you very much, Congressman. We really appreciate those thoughts and insights. The next session is going to be moderated by Ann Coleman, who's going to lead us through a session on surveillance and research. Please, Ann.
Good morning. I'm Ann Coleman, and I'm a professor of ophthalmology and epidemiology at the Stein Eye Institute at the University of California, Los Angeles. And I'd like to welcome you today to the section on future directions for improving surveillance and research. And before we get into our invited speakers, I was going to go over briefly some of the recommendations that the committee made. Out of the 9 recommendations, there are quite a few that are relevant to both surveillance and research. So the first one that I wanted to focus on was recommendation 3. And this is where the committee called out for the CDC to develop a coordinated surveillance system for eye and vision health in the United States. And one of the things I think it's important to realize is that on the committee, every single word and item that you see in each of these recommendations was thought about, deliberated, and so it's really important to realize that everything that you're reading, we really put a lot of time and thought and discussion into it. And so we did recommend that we develop and standardize definitions, because when we look at what's happening, one of the problems with monitoring systems is a lot of times different definitions are being used. So it's extremely difficult to really be able to make progress or really to make heads or tails of anything. In addition, we felt it was very important to identify and validate the surveillance and quality of care measures to help characterize vision-related outcomes, the resources and capacities within the different communities. And so once again, we put a lot of thought in that you need to identify and you need to validate. We also recommended that we integrate eye health outcomes, also objective clinical measures, and risk and protective factors into existing clinical health and population health data collection forms and systems. Because we do have population health data collection in the United States, but we should have vision and eye health there. And so that was one of the recommendations of the committee in recommendation 3. Very important to integrate what already is in existence in the United States. Why don't we have vision and eye health there? That was a big question for the committee. It's a big question for the United States, because you do find it in other countries around the world, and why not here? In addition, we recommended to analyze and interpret and disseminate this information to the public. What good is information if you don't share it? And you do need money, you do need processes, you need communication, you need to be able to share the information. But first you have to get it. And so we have a road ahead of us for recommendation 3. Regarding recommendation 7, this one also is related to surveillance. One of the things that's important to realize is that whenever you're looking at what's happening in the community, there's some surveillance. You're doing some monitoring. If you're going to evaluate, you have to be monitoring. You have to have a baseline. And so that's why recommendation 7 is here, that state and local public health departments should partner with healthcare systems to align public health and clinical practice objectives, programs and strategies about eye and vision health. Also, I have recommendation 8 here as part of surveillance and research, because once again, when you're building state and local public health capacity, you're also designing, implementing, and evaluating programs. So once again, that evaluation piece requires surveillance, requires monitoring. It also requires research. And so these are very important recommendations to be aware of. And there's also to develop and evaluate policies and systems that facilitate access to and utilization of patient-centered vision care and rehabilitation services. One of the things is that we do have some patient-centered vision care and rehabilitation services, but what's the access to them? You need surveillance, you need research to be able to tell us that information. In terms of looking at the environment and socioeconomic conditions, once again, designing and evaluating initiatives to evaluate that. One of the recommendations focuses mainly on research, but when you look at a lot of them, that without research, you really can't proceed with any of the recommendations. And so recommendation 4 recommends that HHS create an interagency work group. And this work group is really going to help develop a common research agenda. One of the things that we see is that there are a lot of stakeholders who are interested in vision and eye health, but everybody's doing something different. And so it's really hard to move forward when you have a public that's unaware of how important their vision is. They take it for granted, unaware of how important prevention is or eye health is. And so you really need to come up with some common research agenda. Maybe not everything. It's good to have variety and diversity, but we need some common talking points, some common goals so that we can move forward, especially in today's environment of potential budget cuts. It's even more imperative that we really work hard to get this common agenda so that we can have people aware of the importance of their vision and eye health, and so it's not that all of a sudden that they lose it or a family member loses it and they go, if only I had known. That's a very sad thing to hear when you're a practitioner, that the patient said, but if only I had known, nobody ever told me, or else I would have done something differently. In terms of research, it's recommended to do population-based epidemiological and clinical research on the major causes and risk and protective factors for vision impairment, with a special emphasis on longitudinal studies. Because there's one thing, we've had some population-based studies over the time, 20 years ago for some of the data, and so we really need to know what's happening now. It's a different world than it was 20 years ago. And so that's one of the things that the committee was very interested in, is keeping up with what's happening in the United States now. We're also recommending health services research, focusing on patient-centered care processes, and then looking at also economic evaluations of clinical interventions and innovations. There's so much new information available today that it really needs to be integrated so that we can use that information to make a difference. Recommending also population health services research to reduce eye and vision health disparities. When you look at the research, there are shocking health disparities in the United States, and those do relate also to vision and eye health. Why is that? We really need more research on what's happening and why is it that there are individuals that don't have access, but also is it something else that's going on? Are there cultural things? Are there behavioral modifications that we can do? Or is it education that we can come in and help with so that we help eliminate these disparities? Or at least give everybody a fair chance to have good vision until their time of their demise. We also recommend research and development on emerging preventive, diagnostic, therapeutic, and treatment strategies and technologies. And this also includes efforts to improve the design and sensitivity of different screening protocols so that people can be aware. So this is just going over 4 of the 9 recommendations. Just really wanted to give everybody a baseline of what the committee was thinking when we came up with these, because these are relevant to today's discussion. So it's now going to be introducing today's first speaker, and it's Dr. Janan Stein. She is a team leader for the CDC's Vision Health Initiative, and you can get her bio in the program. But one of the things, we're very fortunate that Dr. Stein joined the CDC in 1998. She, prior to then, was a vision research scientist at Emory University in Atlanta. She's had ophthalmic training, so she's very aware of the importance of vision and eye health, and we'd like to thank her for also helping to put together all of the stakeholders so that we could have this council meeting. So.